My name is Sonya Smith, and I'm the class policy lead at DHS in the Healthcare Administration on the Medicaid team under Dr. Chumalo's wonderful leadership. And our efforts around class has started back in 2017, where we infused the class standards, the national class standards, into our equity policy. And building off of that, it was very essential for our organizations to build a deep commitment to advance health equity. And the national class standards helped with this process. And so we really focus our efforts on making sure that the organizations and the communities that we were serving were able to be inclusive. They were provided accessible healthcare within the diverse populations that we serve. We looked into addressing language barriers. And we also wanted to make sure that cultural competency or cultural responsiveness was across all services.
Sonya, what do you feel has been the most meaningful part of this work?
Just so many different things that I could touch on, but I really feel like the most rewarding aspect has been witnessing tangible improvements within community outcomes, whether it's the community outreach that we're doing, really going into the community and asking what are the needs that you all need, so that when we do the implementations, that it's addressing the needs that the population that we're serving really needs. So whether it's the literacy programs, whether it's bilingual services, we've seen an increase in engagement in preventative care. We've also seen or heard stories from the communities. And in that storytelling, we are making sure that the accessibility is there in the preferred language of the community we're serving, making sure that the literacy level is at an appropriate level, and then also understanding the cultural aspect, right? And how valuable and powerful that will stay at the forefront of the work that we're doing, because that's important to make sure that the voice of the community is at the table as well.
What has been the most challenging part of this work, and how have you managed and addressed these lessons learned?
The most challenging aspect of the job is really just overcoming systemic barriers, period. Making sure that the resources are being provided and that change, that resistance to change, is really being leaned into, and to understand that we're making change for the betterment of the community. A key lesson learned in overcoming those systemic barriers is important in involving that community voice. And that's at every stage, to ensure that is what's needed from the community, and those solutions are relevant and impactful.
If you could go back in time to when you started your health equity work or disparity reduction work, and give yourself some advice, what would you say?
I would really emphasize the importance of patience. I would also tell myself to continue that co-creation within the community. I never want to, as we stated earlier, I never want to build something or create something without that community voice and advocating for the community to be at the table, to be able to speak for themselves. Change in health equity is incremental. It's okay to celebrate small wins and to maintain a clear vision of the bigger picture, and to articulate that, and to be transparent when you don't have all the answers, right? or if the community needs something that is just out of my bandwidth to be able to provide, it's okay. But I also want to remind myself to prioritize self-care and to rely on my team. That collective strength within my team has been so vital for me, and that support from leadership, because this work is challenging.